Good afternoon and welcome to the National Emergency Operations Center COVID-19 weekly briefing for today, the 22nd day of September 2021. I am Lesroy Williams. Thank you very much for joining us for our briefing today. We continue to update you on what is happening in the Federation of St. Kitts and Nevis with respect to the management of the COVID-19 pandemic, of which all of us have a part to play. The pandemic is still with us. It is not over. It is not time for people to relax the measures, the health measures that have been put in place for our own safety. People still continue to die in the world from the COVID-19 virus. People continue to be hospitalized, and thousands continue to be infected each day. A stark reminder that the pandemic is still with us. Thank you very much, of course, for joining us and for paying attention to these press briefings, as our intention is to keep you as informed as much as possible so you can know what is happening. I want to invite firstly to the podium to address us the Superintendent of Police, who will give us an update on the regulations. There are new SR&Os that have been published. Superintendent Henry.
Thank you very much, Mr. Williams, and a pleasant good afternoon to all listening to this broadcast via whatever means. New regulations, emergency powers regulations that is, have been published. These regulations commence today, September 22nd, and will continue in effect until October 7th. There are no new provisions in these regulations. I therefore will remind you of some of the provisions that have been in existence in previous regulations and continue in this new regulation. I would therefore focus today on social activities. We continue to see a consistent double-digit new cases daily. We have to look at some of the possible causes of these cases. One of the ways we know that the virus can be spread is through close person-to-person contact, especially when masks are not worn. Sadly, this seems to be the norm at social activities and at certain business establishments. Regulation 8 continues to restrict mass gatherings, while Regulation 9 restricts persons from hosting, attending, or visiting a private party, banquet, ball, or reception, or other types of social event without first obtaining the permission of the Commissioner of Police. We recognize that there's a need to have social activities, but the police have an obligation to protect public health and safety. And so we need to balance both. Bar owners and their patrons also have obligations. Regulation 10.5 provides for bars to be open for the sale of liquor. However, all persons shall adhere to the social and physical distancing protocols, hygiene protocols, and the wearing of masks while at these establishments. The more these provisions are violated, the longer we will remain in the current situation in which we find ourselves. And so we continue to urge all to respect the protocols which were intended to prevent the spread of the coronavirus. We continue there also to urge your support for law enforcement, the police. We too have to protect ourselves as our unit is affected by the disease as well. And so we have to protect our men while protecting the public at the same time. And so it is important for the public to take responsibility for their own protection and follow the guidelines that have been published in the regulations and that has been promoted by the health authorities. We know what keeps us safe: wearing of masks while in public, physical and social distancing, avoiding crowds and crowded places, and most of all, become vaccinated. You know, vaccine is one of the pharmaceutical provision measures that reduces the risk of infection. And so we urge all to get vaccinated and follow all the other non-pharmaceutical protocols. Thank you.
Thank you very much, Superintendent Henry, and for reminding us that even though the regulations have not changed, that does not mean that we must change from carrying out what we should carry out. Very important. I now invite the Chief Medical Officer, Dr. Hazel Laws, to give us an update with respect to the Health Emergency Operating Committee report for today. Dr. Laws.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone. As per usual, it's my task to share with you the Health Emergency Operating Committee Situation Report for today, Wednesday, September the 22nd. All right, so I'll begin, as usual, by reminding you about the COVID-19 protective measures. The COVID-19 virus, we have evidence that the Lambda variant of the COVID-19 virus is in circulation in our population, and we are recommending that you wear a face mask when in public places. We are asking you to maintain adequate hand hygiene and maintain a safe distance from others. More specifically, please avoid crowds at this time because the virus is in circulation. We want you to boost your immune system, and if perchance you are experiencing any of the COVID-like symptoms, we are asking you to stay at home. Do not go to school. Do not send your child who may be experiencing such symptoms to school. We want you to remain at home. As I said before, the COVID-19 virus is in circulation in the Federation, and between Monday to Tuesday, September the 21st of this week, we've identified 38 newly diagnosed cases of COVID-19, bringing the total number of confirmed cases for the Federation to 1,718, with 317 cases reported in Nevis and 1,401 cases reported in St. Kitts. The number, at present, we are monitoring 743 active cases. 743 active cases are being monitored as we speak, with 140 active cases living in Nevis and 603 active cases residing on St. Kitts. At present, as we speak, there are 11 persons admitted at the JNF General Hospital diagnosed with COVID-19, and there is one individual diagnosed with COVID-19 admitted at the Alexandra Hospital in Charlestown, Nevis. Now, this slide shows the vaccination status of the COVID-19 cases as at September the 18th. So we, based on the data, 51% of the cases are not vaccinated or unvaccinated. 17.4% fully vaccinated, 8.2% partially vaccinated. And so this disease remains a disease affecting mainly the unvaccinated. About 48% of the cases fall within the age range 20 to 50 years. So again, the disease so far is mainly impacting the young persons in the workforce. However, the cases span the entire age range from childhood to over 60. This provides a summary of the present or the current COVID-19 status on the ground. As I said before, the Federation has reported a total of 1,718 confirmed cases of COVID-19, with 317 cases for Nevis, 1,401 cases St. Kitts. So far, 965 of these cases have recovered fully, and we are thankful for this. And so that leaves 743 active cases. As I said before, there are 12 hospitalizations and to date, 10 COVID-19 related deaths. Now, I want to pause and speak specifically to the active cases. So those persons who are diagnosed with COVID, we want you to stay connected with your case manager. So once you've been diagnosed, you receive a call, you're assigned a case manager, and you would receive that initial call. And if there's any change in your condition or your medical status, we ask you to reach out to your case manager. So we want two things we want you to remember. One, stay connected with your case manager, and two, boost your own immune system by eating healthily, which includes a diet rich in fruits and vegetables. We want you to maintain adequate hydration. We want you to exercise. Even though you're in isolation, we want you to walk around and exercise and get some sunlight. Now, in terms of our COVID-19 response, we continue testing cases, testing contacts of cases. We continue targeted testing and random testing. Over the 4-month period, May to September, we've processed over 30,000 RT-PCR samples in the Federation of St. Kitts and Nevis. The way forward involves our continuing the contact tracing process, which is guided by some robust protocols. We are asking persons, when you receive a call from the contact tracer, we want you to be honest, and we require or we recommend full disclosure such that we can continue our efforts or improve our efforts in containing this outbreak. The COVID-19 testing continues. All cases are automatically placed in isolation. Most are in self-isolation in their home setting. Others are transferred to government facilities, and contacts of cases are automatically placed in quarantine. And as I said before, the cases are being managed by the team of senior nurses called case managers, and some of the cases are transferred to the hospital for stabilization and for admission in some cases. And as I mentioned before, we continue our COVID-19 vaccination program. Now, I want to spend a little time in terms of contact tracing because we are receiving a number of calls with inquiries regarding contact tracing. So if you are diagnosed with COVID-19, you would be deemed a COVID-19 case and you'll be placed in isolation. Now, you will remain in isolation until you recover. Your recovery is marked by getting 2 consecutive negative RT-PCR tests. Now, in terms of what's happening, if you are fully vaccinated and you have a breakthrough infection, the time to recovery is somewhat shorter. You can recover within 7 to 10 days. Now, if you are unvaccinated and you are diagnosed with COVID-19, your isolation period may be a bit longer, probably 14 days. And so we do serial testing until we get 2 consecutive negatives. Then you will be deemed recovered and you would be released officially from isolation. Now, if you are a contact of a case, so if per se your sister is diagnosed with COVID-19 and you had contact, you interacted with her, you may be automatically placed in quarantine. Now, if you are unvaccinated, your quarantine period is 14 days, and so you will receive 2 tests. An initial test at the beginning of your quarantine period and a second test at the end of your quarantine period. And if the 2 tests are negative, you will be officially released from quarantine. Now, if you are a contact of a case and you are fully vaccinated, you'll be monitored. We monitor you for 7 days. So you will be tested initially, and once that initial test returns negative, you will be allowed to work and continue your daily activities, but we will monitor you for signs and symptoms of COVID-19. Now, 7 days after your last contact with the case, you will receive your second test. And if both test results return negative, then you will be released from monitoring. So that this provides you a summary of the protocols we follow, or protocols that guide the contact tracing process. Now, this is a summary slide that provides you an update regarding the vaccination program. So to date, we have 21,916 persons fully vaccinated. So that's a coverage rate of about 66.3% of the target population being fully vaccinated. So 66.3% of the target population fully vaccinated, having received the first and second dose. The coverage rate in terms of the first dose is 75.2%. In terms of the children, 12 to 17 years, 5.7% of the children within this age range have already received the first dose of the Fisa Biontech vaccine. So this gives you an idea as to where we are at in terms of our vaccination program. I dare say it has been successful, and we are encouraging those individuals who have not yet come on board to empower yourself with the latest information regarding the vaccine that we are now offering, the Pfizer Biontech, and we want you to come on board. The Pfizer Biontech vaccine rollout commenced on September the 1st, now 22 days hence. This vaccine, it's safe, it's effective, and it's accessible at each of our health centers, 11 health centers in Kitts, 6 health centers in Nevis. We want you to make an appointment and go in and get your shot. Now, when you call to make your appointment, the nurse managers have been directed to make sure to give you an appointment, a date and time when you can come and get your vaccine. We are targeting persons 12 years and over in order to, these are the persons who qualify for this vaccine, persons 12 years and over. This vaccine has a vaccine regimen of 2 doses given 21 days or 3 weeks apart. So when you go for your first dose, you will get an appointment whereby you will be asked to return in 3 weeks' time to receive the second dose of this vaccine. In terms of the COVID-19 protective measures, as I said before, we want you to come on board and accept the vaccine if you have not already done so. And those of you who have received your vaccine and are fully vaccinated, I want to remind you that the electronic version of your COVID-19 vaccination record card is available. So make sure to get the electronic version of your vaccine record card. We want you to wear your face mask at all times, maintain adequate hand hygiene, and please avoid crowds at this time. The virus is in circulation. And if you are experiencing any of the signs and symptoms of COVID-19, we ask that you stay at home. These are the most common COVID-19 signs and symptoms. The cases complain mainly of headache, altered sense of taste and smell, joint pains, muscle aches, probably a dry cough, nausea, feeling as though you want to vomit, watery or loose stool. Some complain of body aches and a low-grade fever. So these are the common COVID-19-like symptoms that our people have been complaining of. If you're experiencing any of these, please remain at home. Do not go to work, do not go to school, remain at home. Thank you.
Thank you very much, Dr. Laws, for your presentation. Mr. Abdia Samuel, who is the chair of the National COVID-19 Task Force, is unable to be here today and has sent his apologies. We therefore go right into the question and answer segment of our briefing. And the first question is from Von Radio. Given the recent COVID-19 exposure incidents in the schools, is the Ministry of Education considering online learning and teaching for schools going forward? And is there a given date the next batch of Pfizer vaccines will arrive?
First of all, I think the Ministry of Education is already involved in online learning, and so whenever school is closed, they simply revert to online learning. So that's in place already. We got 11,000 plus doses of Pfizer Biontech vaccines. I don't think we've used even 500 as yet, and so the focus should be on getting persons out to be vaccinated instead of focusing on when we are going to get the second shipment. These vaccines are precious. The vaccines are scarce. There is no reason for us to have vaccines in a refrigerator, for them to expire on us, for them to be unused. And we're talking about getting other vaccines. So I want everyone who has a platform to encourage persons to come out and be vaccinated. I think that's all the questions. Yes.
This cases with the schools and the schools being virtual has been in the news for quite a while. Okay. The next question is from an Andrew Huey of SKN Newsline. With the UK not recognizing Jamaica's vaccination program, which comprises mostly the AstraZeneca vaccine, what assurances do we have that the United States and the United Kingdom recognize the vaccination status of persons from St. Kitts and Nevis who have gotten both doses of the AstraZeneca vaccine?
All right, so I want to assure the public that the United Kingdom recognizes the AstraZeneca Oxford vaccine from India, Serum Institute of India. That's the Covishield vaccine, and I think they also recognize the SK Bioscience, because there is a list that is available to the public online regarding the UK, and there are other territories with who administered the vaccines that we administered. They have made that list. What I want to say is that the United Kingdom, they have sent us a number of questions regarding our vaccination program, which we have answered, and in terms of St. Kitts and Nevis and our population traveling to the UK, within short order, we expect that St. Kitts and Nevis will be on that list, whereby our vaccines the vaccines administered locally will be accepted like other islands or other neighboring islands.
Thank you very much, CMO, for answering that question, which has been on the minds of many persons. This next question: how many labs are providing test results, and why is it taking so long for results to be given?
At present, the Next Generation Lab, Avalon, and QDL labs are providing laboratory capacity, and they are processing samples. The JNF General Lab, we hope, will be back on stream in short order. Now, the length of time, or the time lag between testing and results, has lengthened because of the surge in the number of cases and the involvement of our schools. And so within the last week, hundreds and hundreds of samples were taken and are being processed, and that explains the time lag between the conducting of the sample taking and the end result being disseminated.
Someone just sent me a news item with respect to the last question about the UK and the acceptance of our vaccines, that the UK has now recognized the Covishield AstraZeneca and has added our vaccines to the approved list. So that answers that question, that the UK, St. Kitts and Nevis citizens have no need to fear going to the UK, because they will be accepted with the Covishield AstraZeneca vaccine that they took. This next question, has the government or the Ministry of Health made a determination on the full reopening of the borders? The last date that was indicated was October 1st.
Borders have been open for some time now. The question asked about full reopening, and everything happens gradually. We saw just recently we had persons coming in for an international event being held at Warner Park. We saw a cruise ship that pulled into our shores and persons were coming off. But in terms of the degree of movement of persons once they come off, everything all depends on the level of vaccination. And so whether or not we go to what you consider full opening, it's in your hands, that is the people of the Federation of St. Kitts and Nevis. And so we are hoping to get to a significant threshold of immunity before we can say persons can come in and move around freely without the risk of persons getting infected and overwhelming our healthcare system. Yes, we understand that if somebody is vaccinated, they may get COVID-19, but we know that the vaccine protects you from severe disease, hospitalization, and death. And so what we're hoping is we get the majority of persons vaccinated, COVID-19 can either go away or it can become something that you just remain asymptomatic or have mild disease and continue to move around. And so we are aiming now to get to at least 80% of our population vaccinated, which means that with that vaccination coverage, our risk of overwhelming our healthcare system can be significantly reduced. And so anybody who's asking about full reopening of the country, we need to ask you to ask persons to go forward and be vaccinated so we can get to that stage safely.
Thank you, Dr. Wilkinson. There's a question there if the Ministry of Health has carried out any studies with respect to the various lockdowns and if they have affected persons in terms of eating habits, increase in diabetes, and that sort of a thing.
What a lockdown is intended to do is to curb the spread so that our healthcare system is not overwhelmed, and it gives the healthcare system a time to catch up and get things in place. We've had, I think it's 2 lockdowns so far. They were for a 2-week period. I know that lockdowns can have serious psychological effects on persons, etc. We have not carried out any study during those 2-week periods, but hopefully we will not be having any lockdown coming soon, and you can prevent us from having a lockdown by making sure that you obey the non-pharmaceutical rules so that we can curb the spread. And again, I keep coming back, sound like a stuck record, go out and get vaccinated.
This next question is from ZIZ. Lately, students have been turning up to school with outstanding COVID-19 results. Is the Ministry of Health liaising with the Ministry of Education and Social Services to find out about the family structure of those persons?
I want to make sure I got the question. Are we inquiring about the family structure of the cases?
Yeah.
All right. Yes, so when you are diagnosed with COVID-19, the contact tracers, they make a call, and it's an extensive interview whereby they get information regarding your contacts and your family structure. And the case manager you're also assigned a case manager, and they are also they conduct an extensive interview whereby they ask you your age, demographic data, your underlying conditions, because that's very important, and they also seek information regarding your family structure. Who do you live with? How many rooms are in your house? Are you assigned a room alone? Do you have your own bathroom, etc.? And so, yes, we do glean that data from all cases.
I think part of the question is the students are turning up without having the results given to them.
I am not.
Tested.
I am not aware of that because Mr. Williams. Now, for example, we have a number of classes at ICCS implicated, and so they're at home in quarantine. They have been tested, and the results are available. And so, Bastia High School, I don't remember how many forms are implicated. We had mass testing, and once the results become available, they are disseminated. Same thing with Washington Archibald High School. And so I'm not sure, there seems to be a disconnect, but once a school or class is implicated, the Ministry of Health works closely with the Ministry of Education, and it is sorted out.
I must admit that I have not heard any case like that. What I have heard is that there are some students who are turning up to school who are showing symptoms, and that their parents should not allow them to go to school if they are showing symptoms. That is what I have heard, but not that any person who is in quarantine is coming out and coming back into the school. I think the Ministry of Education is doing a very good job in working with the Ministry of Health, and I have had, concrete evidence of that happening. This person is asking a question in terms of how single-parent homes, that most homes are single-parent homes, and how parents would be able to afford to purchase food and pay their bills if they are home for 14 days at minimum and unable to afford sitters and all of that sort of thing. Dr. Laws.
Okay, so Mr. Williams, as far as I'm aware, the case managers, they work closely with the Ministry of Social Services, Community Development, Gender Affairs, and so those families are identified and assistance provided accordingly.
This next question, can pool testing be done by schools, classes, and save cost and time? And the other one is it kindly possible to indicate the vaccination status of the persons who died from COVID, and how many were fully vaccinated, how many were partially vaccinated, and how many were not vaccinated? I think that information was presented already. Is it the protocol that whole classes must be shut down every time a child in school tests positive? Why can't the affected child be isolated only?
That's why you ask quite a number of questions. I will try to answer some. If I leave with any, the CMO will come or Ahmed Henry. We do batch testing all the time. In other words, when a sample is taken from someone, 2 samples are taken, and if there is a class of, say, 40 is implicated, the 40 will undergo batch testing. If that batch is negative, then it means everyone is negative. If the batch comes out positive, then the individual samples will be tested individually. And so that saves time and money. So batch testing has been done for quite some time now. What are the other questions? Yes, in terms of the deaths, I think the CMO gave this information before. Of the 10 deaths that we had, 8 were unvaccinated, and some of them had pre-existing conditions. Now, I'm going to ask Cromwell to address a matter, because one of the questions that was asked previously, it was about persons who are supposed to be in quarantine but showing up to schools, although they were not given official release. We are not aware of that happening, but I believe that an adult, they have a responsibility to stay home if they are supposed to be in quarantine, and if there's a child, the adult is responsible for that person. But you can address that for me.
I think, Dr. Wilkerson, you have said it. I'm just going to repeat what you just said. Quarantine persons have a legal obligation to respect the quarantine conditions. Whenever you are placed in quarantine by the Ministry of Health, you are obliged by law to respect and honor the conditions of your quarantine, which simply is to stay at home and avoid contact with other persons. Now, in the case of children, the adults, the parent, is responsible for the actions of the child. So that if a child is placed in quarantine by the school or by the health authorities, that parent is responsible if the child goes out and interact with other persons. So parents, please ensure that your children remain at home whenever they are placed in quarantine. You have a legal obligation to ensure that the quarantine conditions is maintained. It carries penalties up to $5,000 for persons who violate their quarantine. So this goes for everybody. Once you are in quarantine, you are required to stay at home. If you need to come out, if you need assistance, you have a case manager. You have a number, 311, where you could call to state your case or ask whatever assistance you need, and it will be provided. You cannot take it upon yourself to go down by the shop to get a top-up. Stay at home and respect your quarantine condition.
There was another question that spoke to classes, and if you have a class and there is one student who is identified as positive, do you close the class or put everybody in quarantine? And so the answer to that question, well, let me just back up. Now, if you have a class with 25 students and one of the 25 students is identified as a case, now that student would have interacted with his or her classmates. And so if you merely isolate the case, the student who is impacted, and not do anything with the rest of the class, you can end up with an outbreak within the class. And so in terms of public health practice, you have to place the class in quarantine, you have to do contact tracing, in terms of finding out the students, the classmates with whom that student interacted, and those individuals must be tested. And so that's our practice, and so far we've picked up or identified a number of contacts in classes where you had an initial case. So it's important to do so.
I just want to add here that we have an opportunity to keep our high schools open and to go back to regular in-class learning, because although the alternative is to go to virtual learning doesn't work for everyone. I know even when I was going to school, dealing with physics and maths, etc., sitting right in front of a teacher was difficult, and it's even more difficult if you are sitting in a computer, in front of a computer, and you can interact with the teacher directly. But our opportunity is to make sure that our high school kids get vaccinated. We have a vaccine now for our 12 to 17-year-olds, which means that every high school kid can be vaccinated. And if we get a significant vaccination coverage in our high schools, we will not have to be sending home the entire class when someone is exposed. We also know, too, that recently Fisa applied for emergency use authorization for the vaccine for 5 to 11-year-olds. And in another month or two, it might be approved. It's approved already, okay? And so we need to make sure that we stay ahead of the curve. We have the opportunity to vaccinate every adult over the age of 18. We have the opportunity to vaccinate every teenager, 12 and over, and very soon we'll have the opportunity to vaccinate the younger children so that we can rid ourselves or be able to live comfortably with COVID-19, knowing that it will not be a death sentence or a sentence to severe disease. So please, I ask you again to go out and get vaccinated.
Thank you, Dr. Wilkins. You know, there are several countries in the world, some of them in Africa, where they are looking for vaccines and there are no vaccines. And people need vaccines, and several of the questions I realize that have come are asking, when are we going to get additional batches of vaccines and other vaccines, and the vaccines that are here, people are not really coming out to get them. It's really ironic. Have we had confirmation on whether the Delta variant is in circulation here? And the second one, I believe we received an additional batch of AstraZeneca in early July, and those expired at the end of August. If someone received the first shot early July, then the second dose would become due in less than 2 weeks. When do we expect another batch of AstraZeneca?
Very good question. We are still trying to identify the relevant, a source through which we can ascertain the needed doses of AstraZeneca Oxford vaccine to provide a second shot to those who would have received the first. And so we would continue trying. Now, in terms of the Delta variant, now we have sent off about, to date, 3 batches of samples to Caribbean Public Health Agency, and of the batches, only 2 samples returned positive for Delta. And those 2 individuals were inbound passengers who were in quarantine, one in Nevis, one in St. Kitts, and those 2 individuals remained in quarantine in isolation until they were recovered, fully recovered, meaning they got their 2 consecutive negative results. So in other words, we are, pretty sure that the importation of the Delta variant was controlled or contained. All right, so in other words, we only have evidence that the Lambda variant is in circulation. We will continue sending off samples for genomic sequencing because we need to know, what variants are in circulation at all times. Thanks.
Okay, that brings us to the end of our question and answers for today. There's another question. For clarity with respect to the acceptance of the vaccine given here, does this also apply for the US? Someone is asking. The US has recently said that, maybe Dr. Wilkinson, you can speak to that. The US has recently said that come November 1st, all persons traveling to the United States must be vaccinated and show proof that they are vaccinated.
I recently traveled there and showed my AstraZeneca and
Right. So Dr. Wilkinson is saying that he recently traveled to the US and showed his vaccination record of the Oxford AstraZeneca and had no problems at all. That brings us to the end of the question and answer segment. I want to thank you for sending in your questions. And equally, we continue to provide you answers to your questions. I thank Superintendent Cromwell Henry for his report today, even though the regulations are not new. They're the same regulations from the last time. We are called to adhere to the health measures that have been put in place in those regulations. We thank the Chief Medical Officer who continues to labor very tirelessly. Of course, you know, the COVID-19 pandemic is not easy for anybody around the world, but we can make it a little bit easier if we do what we have to do. It puts less strain on the resources of the country, and if you realize what is happening with the schools and other places and so on, we're all affected. And so therefore we have to be mindful of the fact that my behavior can affect others. Thank you, Dr. Wilkinson, for your support and your continued presence here in answering the questions that are asked. We thank ZIZ for continuing to cover these NEOC briefings, and we thank all the media houses in the Federation who continue to partner with us in getting the word out in terms of what is to be done to help in this war against the COVID-19 virus. I want to thank all of you for joining us for our briefing today. We will be back next week with another COVID-19 briefing. Until then, take care. I am Les Roy Williams.